Okay, welcome to the Innovators Mindset. I'm Vic Addo. I'm here with Mehmet Kazgan from cliexa. Mehmet, thanks for doing this. Really appreciate it.
Thanks for having me, Vic.
So talk to me about what you saw with your customer base. What challenges were they facing in this COVID-19, sort of crazy time, and how'd you approach it?
Sure. So the existing customers, the first time it hit, we can imagine the whole, if we want to see the patients in the clinics, as we serve into small, mid-sized and hospital systems, they started to get into the phase of like, what are we going to do now? Are we going to see the patients or not? And there's the whole CDC guidelines about what they have to do for keeping them at home deal. So what we did, as we are a full-scale virtual intake as well as management platform, we quickly enabled the check-in process to kind of overcome that challenge. And the number one challenge they were seeing, should we keep them at home? Should they come to the clinic? Should they go to an emergency room? So that was the number one thing that we have seen through the challenge, that you could have seen their numbers started to go down with the scheduling. They didn't know what to do, and even like switching to that kind of like clinical process of, should we have these people in or out, or should we even talk to them, was kind of the biggest challenge.
Yeah, interesting. So give a little background. Who are your typical customers? Talk about cliexa and your perspective on this challenge from that point of view.
Absolutely. So cliexa is a virtual healthcare platform. So when I say it's a big, wide thing, we are an enabler for any type of clinics, from a single family medicine doctor-owned clinic all the way to the hospital system. So we're saying we can actually onboard the patients 90% on the clinical side, which is subspecialty agnostic. We have 8 platforms. The cardiovascular platform we built in partnership with American College of Cardiology for home health monitoring. So we can go to any practice and say, let us know your clinical intake process. We can check in your patients, give you the indicators that what you're going to do next. And in between visits, we can also monitor your patients. Either it's a medical device, either it's a claims data, either it's symptoms, complications. We package that all up, tailored for the clinics, and we just basically built into an integrated solution to the EMR. The whole front end is a mobile app, and we don't give another screen. We enable those into their existing EMR systems.
Okay, so you have these customers and they're intaking patients on a mobile app, and then COVID hit and they needed to add to that, right? So what did you do first to add to that, or how did you approach that?
Exactly. The first thing they were facing as a challenge is they had to follow certain guidelines. They have to collect some CDC required documentation. It's an emergency department, or it's like a single family practice. They have to collect this data. So we basically implemented COVID screening platform into the mobile. Either they're in the clinic or they're actually doing this from home. So they actually go through the CDC-based guidelines, and then we identify their risk according to what the risk should be, and we tie this up into their chronic condition, and we were generating that report for the first phase for what they have to do. So if you're going to say you're high, we can do this at home. You're low, you actually show up at the clinic, so they can drive their process through it. That's what we first did.
So give me a sense of the scale of it. Like, that sounds like a lot of work. How fast did you and your team pull this together? What was the process like?
It actually took us literally a day, Vic, because the mobile platform with existing customers, we just added a button called remote check-in if they want to check the patients from home, and they can do telehealth sessions. And that actually enabling the COVID screening platform literally was a couple hours of like adding the screen workflow. That's what cliexa does. We dynamically update workflow. So it was like a matter of a day we updated that screen and gave it to us.
Okay, interesting. So I guess because cliexa has this workflow architecture and already a mobile app, adding this on was easier than it would have been for some other groups to add.
Yes, you're right. Yeah.
Okay. And then talk to me about the breakthrough moment. Is anyone using it? Is a clinic using it and helping patients?
Absolutely. So here's the interesting part. One of the largest clinics, mid-sized clinics, like seeing 2,000 to 3,000 patients a month that we have with multi-disciplinary approach, the first time they got a hit for 80% of losing patient volume. So they switched into remote check-in and telehealth process. Kudos to them. They were pretty good at it. But enabling that remote checking and telehealth, they're actually, with the April numbers, they're like 20% more than 2019 averages, to give you some straightforward KPIs.
Wow. So where most physician groups and clinics and hospitals are suffering just because the patient volume has drawn down, your clients are actually doing the same or maybe even a little better than last year.
Exactly. So think about this way, Wick. Whatever you do, either telehealth or a phone call or a FaceTime, you got to intake the patient with a new follow-up. You got to document it so you can bill for it. That's the standard process. So what we're doing is we're enabling all this clinical information gathering documentation already done. So you can even call the patients with the new CMS guidelines and flexibilities. They're actually increasing their possibility of even getting more clinically efficient. They can actually assign more phone calls within an hour, so they can actually get more reimbursements and serve more clients.
That's incredible. And so many clinics and hospitals are struggling financially. Seems like they're going to move towards tools like this to help them be more efficient.
Absolutely. So another way to look at it, to add to that, Vic, so, they blocked, like the government and federal and state laws, they blocked basically optional things like physical therapy or some optional surgery center issues. And now they're getting back up. But the thing is, they are still unable to do remote patient monitoring. Like physical therapy now fully available to do this on visual in a telehealth, but still you got to go through the same clinical and administrative flow to collect what you need to bill for. Even though you provide the service on a visual screen, doctor still needs to document those. So we're literally enabling.
So the fact that it has now been this reimbursement available, they have to get their workflow and their process around where they can intake patients, they can document and bill for it. They're set up for physical, like in-person physical therapy or clinic.
Exactly.
And cliexa can help them sort of make that transition.
Exactly. And here's the other part that actually it's more visionary. I got to tell you that, Vic. So now we know there's a certain population with COVID, whatever their risks were or are. Now you apply some certain treatments and you can still monitor them with the COVID, and you can see the differences in scale. So you can actually see the real risk that's identified is not the real risk that you should be looking for. As an example, if you're a patient of 65 and above and not travel to China, I think you're medium risk. I'm just making this up. If it doesn't matter if you're actually 14 years old, but if you have COPD or any type of breathing issues, that makes you automatically high risk and you got to go to the emergency room. So trying to contain people at home is one thing, but chronic condition management adds a separate level of risk that would actually add. Now you can look at the before data and after data and see the data across time. You can make clinical decisions for another pandemic that's coming up, second or third, or for another disease.
Yeah, so it's interesting, like your tool allows that reach out mobile into the community and interact with the patients much more effectively over telehealth. But then it also screens and pulls out a risk profile and says, okay, Vic, you're at high risk. You have asthma, COPD. So we need you to come into the emergency room. So it doesn't lose people in that process, which I think is
absolutely. And we already recorded your clinical profile. Now we know where you're coming. Whatever it's going to be done is also going to be recorded, right? We already done that paperwork digitally, signed the consent forms, collected your clinical profile. Now we're going to have your clinical treatment model, medications, and we can monitor your devices. Then in time, we can say, oh, here's the deal. We are all straightforward with compliance. We looked at the screening, but how it applies into your chronic condition, how it changes in time will give us a better picture of how we should, like, we're doing this in location-based, like zip codes and social distancing. But the real deal is when you get affected by it, which we will be eventually, but it puts you in a different risk category if you have a certain condition that will affect it differently. Even the symptoms are changing today, right? So we don't know enough, but this might help to learn enough is kind of like the vision.
Yeah. Excellent. Well, Mehmet, thank you for sharing this. I'm super excited about you building it. I think it's going to really help a lot of people out there. If people want to find out more, is there a website or something they should hit to learn more about it?
Absolutely. They can go to www.cliexa.com, cliexa.com, and they can reach us directly and they can see what we're offering over there in details.
Yeah. Okay. Thanks for doing this. Really appreciate you fitting it in.
Thanks for giving me the chance, Vic.